What we're going to do right now, this is another way to do contact reflex analysis using changes in the leg length. So we already determined that Crystal needed some choline, and I'm going to go back and check those very same reflexes once again through her leg length. Those of you who've been to chiropractors before, very often they use changes in the leg length as one of the analysis to determine what's going on with the patient's spine. I'm expanding it to not only the spine but to the organs and systems of the body too. So what I'd like to do right now, Crystal, take the palm of your right hand and put it on the side of your head, like on the side of it. There you go. There you go. This once again represents the right side of the brain, the right cerebral hemisphere. And what I want to show right here when I bring her legs together, I don't know if this will show on camera, it very well may, that her legs are relatively balanced or even. This means that the right side of the brain doesn't want any help. It's pretty much in homeostasis. Now switch and put your left hand on the left side of your head. This represents the left cerebral hemisphere. This is the part of the brain that is more associated with remembering things, recall, concentration, focus, language, that sort of thing. And now that she puts her hand there, I don't know if the right leg draws up maybe about 1/2 to 3/4 of an inch. Take your hand away for a minute. And then after a few seconds, see the legs start going back to even again. I'm trying not to do this sort of thing with the patient. Keep the legs even, and I'm bringing them up a little bit off the table just so there's less friction or drag on the table so her legs can respond, the changes in the leg length. So what I'm going to do is I'm going to pretend, I'm just going to rub up on the bile duct reflex because she needed choline. Go ahead and put your hand on the left side of your head once again. And if we give her choline to help her brain have acetylcholine, the main neurotransmitter, see this time her legs stay balanced. That's indicating that choline will satisfy that reflex and help the functioning of the left side of her brain. Because one of her symptoms coming in today, she said focus and memory, remembering people's names, that sort of thing. Very often when people have ADD or cognitive dysfunction, this is one of the things I look for, and it's very helpful for the patient. So go ahead and take your hand away. And what I'm going to do now is I'm going to go, this is a reflex on the side of her knee. This is a way to assess the part of the brain that runs the body called the autonomic nervous system. And I'm asking, is there anything else on this visit that the body would like to have to bring her back into balance and help her get well and be healthy? So we're going to erase it. And this reflex has a numerical score of a 90, and we're going to count. 10, the leg will drop on the number that the reflex is at. 10, 20, 30, 40, 50, 60, 70. We have an 80 number. Usually when the reflex is an 80 number, this is when the patient has more structural needs, like chiropractic adjustments, that sort of thing. So we can ask the body if she needs that. Here we go. I'm going to use a little mental intention here. If those of you who are aware of this I'm asking the body where it would like to be adjusted. There's also ways through the traditional analysis procedures to ask if there's a misalignment in her spine that needs chiropractic care. But we can go like this: cervicals, the legs stay balanced; dorsals, lumbars. As soon as they give the command for lumbars, her right leg draws up, and then we'll ask which lumbar vertebrae would like help. L1, there's 5 lumbar vertebrae. L2, L3, body left, body right. So she has a 3rd lumbar vertebrae. I don't have my activator here. We do low force chiropractic techniques here, so since we're on camera, I'm going to do something. This is a form of chiropractic called DNFT. For you old timers, this is one of the first ways that it's called low force chiropractic. And we can even just go right over the spine like this. Normally, if there was a subluxation here, this would also make her leg draw up. And now the legs are staying even or balanced. Or we can ask again through mental intention: L1, L2, L3, L4, L5. Now we're finding a sacrum that's out. When I say sacrum, the leg wants to pull up or draw up. Another way to do this too, Crystal, just take your right hand and put it right over your tailbone, like right here. This is called therapy localization. When they have the patient put their hand on a particular area or reflex, the body knows we're asking about that. What about it? In other words, does that area need some help? And then we'll go back to her leg length and see the leg, in fact, does draw up. And now we're going to adjust her sacrum. And for you chiropractors that need or chiropractic patients, this will be what's called a base posterior adjustment on the sacrum on both sides. And put your hand once again right over the lower back there. And if we corrected that subluxation, the legs will balance. That's an indicator that the body's satisfied with what we did for that. What's interesting in the work that I do, Dr. D.D. Palmer, the original chiropractor said there were three things that made a person subluxate. And those three things that make the spine misalign or subluxate are either an injury or a trauma, nutritional deficiencies or toxicities, and the third he called autosuggestion, stress, or the mind-body connection. Very commonly, when I have a subluxation in a patient's spine that keeps coming back, there's something deeper that's making it happen. You might be familiar when you put a circuit breaker on and every 5 minutes it keeps popping back off again because there's too much load on that circuit. It keeps making it come up. The spine is very much the same way. If I get a patient with a recurring subluxation, then very often we need to address the nutritional or other needs of the body to make it stay. It's called a viscerosomatic reflex, according to Dr. Palmer, that developed chiropractic. In my practice, even though I'm trained as a chiropractor, most patients coming in to see me did very little adjusting, because when I start addressing the nutritional needs of the body starts holding their adjustments. For instance, if Crystal had a weak bladder, the bladder gets its innervation from the lower part of the back, particularly the sacral spine. And if she had a weak bladder, very often it can refer pain into the lower back. It'll keep causing a subluxation per se in the sacroiliac or sacral area. And then when I do protocols nutritionally to help the sacrum, the subluxations disappear. They stop coming back again. So let's see if there's anything else that she would like. She had some structural needs. She needed choline. And the body here, when I check this reflex, we're triaging. In other words, it's saying what's uppermost on the body's mind's eye to bring it back into balance or wellness. So I'm going to ask, is there anything else that she needs on this visit besides the choline and the adjustment? Keep in mind that I've already treated her before, so some of the needs of her body have been met. And also, too, when a patient comes in to see me, if they're seeing other practitioners, already taking supplements, they're doing things for their body. When I test somebody, the body's only showing what's left. In other words, what need has not yet been met, because it's a total summation of all the good things she's doing for her body, and the body's just showing where it has not yet been served. So let's ask if there's anything else that she needs besides the chiropractic adjustment and the choline. And see, her legs are balanced now. So that's the way the autonomic nervous system saying that for this particular visit that her body's satisfied. What I want to show is also to the fact that she needs choline. I want to check some of the other areas of her body that would benefit from the need from choline. So I want you to take your hand and just slide it right underneath your rib cage, right about here, kind of all the way under you, the whole hand. And what we're tuning into, this is called the biliary system. This is the liver, gallbladder, and bile duct collectively. And if she needs help in that area, one of the legs will draw up, and in fact, it does. The leg pulls up. So we can even just ask mentally, does the liver one help? Does the gallbladder one help? The legs are still balanced. Does the bile duct one help? And then it draws up on the bile duct. Keep in mind that from a physiological standpoint, when she takes choline, one of the other functions of choline is that the liver uses it to produce something called bile. And bile is something that helps a patient digest dietary oils and fats. Plus, bile is something that carries excess cholesterol out of the body, and it's made from choline. So when a patient needs a particular supplement, it's almost like the whole body wants it in many different ways. So keep your hand there, and I'll just say 600 milligrams of choline a day, which we ascertain. I'm using a little mental intention here, and then her legs balance up. The bile duct will benefit from that. Now take your hand and put it right about here in the lower right abdominal area. This is the first portion of the colon. It's called the ileocecal valve. And the lower digestive tract loves bile, and it loves choline because it's a lubricant for that. Plus it helps the body to break down and digest food. So here's the ileocecal valve. See, the leg wants to pull up. Even it needs help. And if I say 600 milligrams of choline a day, then her legs start to balance. In this type of work, because we're tapping into the autonomic nervous system, and because this work is not based on symptoms, this work is based on what the body wants to achieve, normal physiology, I can give a patient one particular nutritional supplement, and it will cascade through the body in many different ways to help the patient. Notice I didn't give her a whole basket full of supplements. One thing to address many different needs of her body: the brain, the cognitive function, her skin, her digestive tract, her liver, or excuse me, the bile duct, to help her in many different ways. And patients appreciate it because I'm very well aware, if you look at their kitchen counter in most homes, a lot of patients of mine, prior to seeing me, they have a basket, possibly 12 or 16 different supplements sitting there, hoping that one of those things will hit the nail on the head. With the work I do, because it's very specific clinically, most patients when they come in need one or two things, possibly three at the most, to affect very significant change in their body. And the body understands where to begin and where to help them. One of the things I'd like to add about my particular practice is I'm totally referral, which means everybody that comes to me has been sent to me by somebody that I've helped. And I'd like to ask, may I help you? Also, too, I would like to add that this particular work here in Virginia is offered on a continuing education basis through the Life Chiropractic College. And here in Virginia, the Virginia Board of Medicine that licenses the chiropractors is aware of the course content, and they approved it for relicensure credit hours. It's called CEU credit hours for relicensure in the state of Virginia. They understand the content of the work, and they approved it here. So I want to let you know there's science and validity behind that. And thank you for watching.